pharmacy, counting every dose, learning every detail that nobody else knows. But my mind go far, they think I they see. Is it more for my life? What's next for me? I know they stop, how they move, how they go, From farm to man, I'm chasing my goal. No be restart.
Hello, everyone. Come on over, sit down for a second. So Ravi, the infectious disease pharmacist who going medical school. Okay, but y'all, can I be honest? I miss being a pharmacist. So this is only going on week 3 of medical school, being away from my patients for maybe like 3.5 weeks. Because I made the decision kind of last minute. Money came in for scholarship, and I was able to leave. But let me just tell y'all a little bit about like what it actually means to be an infectious disease pharmacist, working at the VA at the top of your license, seeing your patients. I left a really good life. So I'll start off with an infectious disease pharmacist is one who's been through pharmacy school, of course, and then residency. So I did my general residency, PGY1, at the Miami VA in Miami, Florida. That was a wonderful experience. And then after that, decided, well, I already knew I liked infectious disease because I love the organisms. I love bugs. Anybody know me who's been a student of mine? No, my favorite organism is, for sure, and it's Pseudomonas. And my favorite drug, I guess I have a lot of different favorite antibiotics. It depends on what we're talking about. Like, if we're talking about cephalosporins that you can take orally, it's cephadroxil. I mean, hands down. And if we're talking about an IV cephalosporin, for sure it's cefepime. For sure. Like, yeah, you may have some altered mental status, but like, we're gonna save your life. We're gonna save your life. But anyways, what does it mean to be an infectious disease pharmacist? So I told you about the residency. I did my second year residency at the Cleveland VA, where I just came from working. And that was a wonderful experience. I literally cried at the end of my residency program because I wanted to stay. I'm like I'm not done with y'all. Y'all not done with me yet. But my residency program director, at that time, that was Sharon E. Sims, Dr. Sharon E. Sims. She was like, no, little birdie, you got to go fly. And I did. And I worked in Louisiana for 4 years. I was at Our Lady of the Lake for a few years. Love the physicians I worked with. They were amazing. They were amazing physicians. Shout out to all of them if they're still there. Some that come to mind that I really, really just enjoyed working with. It was Dr. Catherine Levy and Dr. Miachek. I loved everyone, but like I love them down. Yeah. I mean, but everybody was great. Well, the physicians. I had to give y'all a whole nother story about the pharmacist at another time. But anyways, then I worked at Baton Rouge General for a few months. Shout out to Dr. Erica Chavis, who helped me get on there for a few months, and I was able to do some amazing things like get their aminoglycoside protocol together. It was really a nice time. But the job I just left, okay, which I'm like, man, like, are my patients okay? They're okay, right? Like, I know they're okay. Like, they have very competent pharmacists who are there to take care of them. But I just know they don't have as much time because like they're down. We're down to infectious disease pharmacists, but the new one is starting tomorrow. Well, when I post this video, she would have already started. But the things I miss most, and if you are thinking about a career in pharmacy and you're thinking about a career in infectious disease, please let me know. I think it is an amazing career. Go for it. It's a great life. At the VA, it was great pay. It's just Trump. I couldn't do him no more. But let me tell you about what I did on my day to day. So, I was an infectious disease consult, so I mainly rounded with the infectious disease physicians and fellows. If there were medical students, and then pharmacy students or residents, we all table around and talked about what was best for the patient, what was best for our veteran. Should they be on antibiotics even? And if they should, which one should they be on? Are they on the best dose of antibiotics? So we need to do anything special, like have it over extended time period so that we can make sure we're meeting our PK and PD parameters. And just making sure that all of our organisms actually were killed by the antibiotics that we were giving our patients. So that was wonderful. And I got to like go over new trials that were out and talk to the team, and they really took what I said into consideration when it comes to taking care of our patients. So that was amazing. And I have pudding and I keep looking at it. This is a little tea time, but this is pudding time because I'm a little hungry. And I should be studying for my test tomorrow. But I just wanted to tell you how much I miss pharmacy. So that was the collaboration, working with the physicians, and I love all the physicians there at the VA, like every single last one of them. And I'm gonna shout one of them out each video. So this video shout out goes to Dr. Dousa. Dr. Dousa was, when I told him I was going to medical school, he was like, of course, like of course, right? Like for sure, support you fully, 100%. Writing a letter, all of the things. Let me know who I need to talk to, hands down. So every week I'm going to shout someone out. And Khaled was on my mind to shout out today. But I have so many. I think it's like 10 of them there. So every video will be a shout out. Okay. So doing the rounds, wonderful. Just love that collaboration, and love like one of the ID fellows like push back a little bit. Like I'm like, no, we should be doing this, and like, no, we should be doing that. But it's always like a fun time, and we always do what's best for the patient, and our patients have a lot to do with the decisions that we make. So that's wonderful. Then I have a lot of patients who just call me, y'all, like I am the OPAT manager. Well, I was. I'm not anybody anymore. But I was the OPAT, so outpatient parenteral antimicrobial therapy, OPAT. So patients who were on IV antibiotics, and we thought it was necessary for them to continue on those antibiotics, but not in the hospital. So they can either go to our nursing home, or they can go to our like a SNF, so a nursing facility, or they go home. And I'm able to help manage them when they go home. So I'm the person making sure that I collaborate with the nursing team who's going to be going out to the home, with the infusion company who will be delivering their medications, and the patients and their spouses and their daughters or sons and family members, just to make sure they're all on one page and we can take care of them. But I have patients who just like to call and chat and ask me about if I can help them get a refill for something else, and I can. Absolutely, I can. But like that sense of being needed it's a wonderful feeling. And then being able to actually help people, man, like, and then a lot of the times, y'all, like, even if you're having a really busy day, like our veterans will say stuff that is just like hilarious. Like it's funny and it really shouldn't be funny, but they know I'm gonna kiki with them. Because I mean, I'm here for you in all aspects. Like however our patients need us to help them, we make a way. So I really do miss that. And then I just got an email from my current resident. I mean, like he's not mine anymore, but like he is. And he's doing a presentation tomorrow on let me show y'all real quick. Just show y'all. It's so cute. It's probably backwards. But on gram-negative bacteremia, and then like talking about like antibiotics and resistance, and his slides are amazing. Shout out Hunter Roth, Dr. Hunter Roth. Like you just made me so freaking proud. So thank you for being my last pharmacy resident. So I miss that, and I miss even my, like I just started to do clinic when that position became available. So like seeing my HIV patients and letting them be able to talk to me and, you know, encourage them, and switching them over to Cabenuva for a lot of them who just don't want to take a pill every day, right? I mean, man, I miss the actual work. And I know I got a problem, y'all. I know it. I love working. I can't help it. That's who I am. That's what I do. Um, all right, I think that's it. This video 10 minutes, and I told somebody that my videos are gonna be less than 10 minutes, so y'all can actually watch it. So remember, knowledge is power. And if you are interested in pharmacy, please, please, please let me know. I would love to get you plugged in. I would love to give you resources. I would love for you to be my colleague in that space. Knowledge is power. Follow, subscribe, all of the things. Thanks. Have a good one, y'all.
Late nights in the pharmacy, counting every dose.